Let's go into the coagulation cascade in detail. So, to know about this, the most important point is the factor 2A and the factor 10A. So, most of the anticoagulants are targeted towards 10A or 2A, and the newer anticoagulants or direct thrombin inhibitors or factor 10A inhibitors. So, they act upon the conversion of fibrinogen to fibrin monomer and prevents the coagulation or prevents the clot formation. So, this is a cell-based model of coagulation where the platelet plug is formed, and first process is the initiation where the tissue is affected and there is an amplification, and then there is the propagation. Propagation is the platelet plug formation, and after the platelet plug formation, the coagulation factors come into play. So, here this is the step, and after this the coagulation factors come into play and a stable clot is formed. So, this is the basic cell model of coagulation, and we disrupt at this phase to provide anticoagulation to the patients. So, these are the various anticoagulants acting at different levels. So, first is the factor 7A and tissue factor, and then comes the factor 10A. So, here factor 10A, the anticoagulants acted upon factor 10A is heparin, low molecular weight heparin, fondaparinux and oral factor 10A inhibitors, and then comes the factor 2, which is the thrombin. Here also there are direct thrombin inhibitors and heparin and low molecular weight heparin. So, they prevent the formation of the fibrin clot, which is important in anticoagulation. So, now coming on to so this is one article where the anticoagulants are acted upon. So, if you see in this cascade, so factor 10A, here rivaroxaban, apixaban and edaxaban acts, and factor 2A where the dabigatran acts. So, they prevent the conversion of fibrinogen to fibrin. So, we have guidelines for the traditional anticoagulations where heparin is stopped 4 to 6 hours before surgery. So, the next one is the enoxaparin, or which is given at the dose of 40 subcutaneous daily, that is stopped for 12 hours, and they can be restarted within 4 hours after the surgery.